physician-assisted suicide. Ethan Rimmel, a 41-year-old psychology professor and father of two, took a lethal dose of prescription sedatives June 13, 2011, and died shortly after. Ethan had been diagnosed with terminal cancer 1 year earlier. Since the passage of Washington State's 2009 Death with Dignity Act, Ethan and 240 other terminal patients within the state have chosen physician-assisted suicide, PAS, as a viable option for ending potential suffering and ensuring the deaths occurred peacefully, as pain-free as possible, and at a time and place of their choosing. Montana, Vermont, and Oregon are the only other states where PSA is illegal. 6 other states, including Pennsylvania, Hawaii, and Massachusetts, are considering death with dignity provisions. Opponents of PSA programs, however, see death with dignity laws as corruption of the ethical code of the healthcare profession going all the way back to the Hippocratic Oath. Others fear that incorrect
that it should be in the case that they need to check with other doctors and physicians and have previous discussions on if their reasoning with multiple doctors is okay for it. And it should be up to physicians to decide if their mental illness or if their case, if it's different or significant in a different way, whether it be if they have been talked into it or talked out of it. The physician should be the determining factor as whether if they're mentally stable enough to go through with this, and if the case is to the severity that it is okay.
And to further what my friend was saying, if we or I or any one of us were a judge, I think we would like to know what second opinions they've had given to them. Because there have been cases where one doctor says you have 3 months to live and another doctor says you have 3 years to live. So getting second opinions is a very important variable in deciding whether or not your illness is terminal for more than one doctor or just that one doctor.
So what about this? My grandmother, who just recently died, was in severe pain and was sort of making suggestions along these lines, why she says she's in such severe pain. But then the doctor found the right combination of pain medication. And then all of a sudden, she was back to her old self and loving life. So is that some more information that you want to know? Whether there's a way to relieve the pain or the depression?
Yeah, definitely if there is another option, that should definitely be taken into consideration. If there are ways to alleviate any sort of pain on the patient, even with a terminal illness where they will die, if they can live that last bit enjoyably, then that should be taken into consideration.
First, I would like to say I'm very sorry.
Thank you.
But yes, we do believe if there is an alternative, then absolutely. If there is a way that person can live the rest of their life in happiness and pain-free, absolutely. But we're talking about the situation as if there was nothing.
So you're pretty clear that it was in terminal cases. I want to know if you think that there are cases which aren't going, the patient is in no immediate risk of death, in which case physician-assisted suicide might be warranted. The type of case I have in mind is paralyzed or handicapped in some severe way as a result of an accident, right? You made a lot of this sort of, they're no longer able to live the life that, they've loved and set up for themselves. As you imagine, quadriplegic, suffered these injuries in a tragic accident, no longer able to live the life, right? He's no longer able to enjoy hiking through the woods, all the things he's loved throughout his entire life. But, as a lot of members of the handicapped community would say, still able to lead a happy life. Would he be justified in seeking the suicide route? Because, for all intents and purposes, he can no longer lead the life which he wants.
We believe that that's really up to the person and how they feel about how they are after the accident, as you said. If the person is miserable and they feel as though they have nothing else to live for, that's an entirely different situation in which they should talk to their family about and discuss what their options could be for them.
And in cases where they're not immediate risk of death or in an unalleviable, I'm not sure what was used there, pain that cannot be lifted, then their need for suicide, their want for suicide is more mental, in which cases there are treatments, they can go through psychiatric treatments to help them learn how to live life enjoyably.
Would we want to maybe have like a cooling off period? Like where you can buy a gun, you have to wait a few days to make sure you're not emotionally passionate or something. So maybe after the accident, first few weeks she thinks she can't live a normal life. But maybe, you know, she adjusts, figures out what it's like to live in this new way, and maybe she could be fine with it. So we also, if you were the judge, want to say, look, you have to wait a year before we'll let you do it.
This sort of ties back into the question about their mental state and their mental stability, in where I think that a physician or a doctor who specifically knows about depression and those sort of mental faculties and dealing with trauma or PTSD should have a say in whether that could be affecting it and if it could be lifted, or if it is something that they will not be able to overcome, or they should have the say on it with extensive research on how it works.
And you said about a cooling period, very good point. That should definitely, you know, need to be implemented, because you can learn to live happily. You know, there are ways to be able to live the life that you have.
Yeah, I completely agree with my friend here. Time should definitely be a determining factor on whether or not it's just an emotional decision or whether or not it's a thought out decision that you thought with your right state of mind.
And one more. Okay, so I have one more. So suppose that a very emotional teenager, you know, breaks up with her boyfriend and is just totally distraught as a result. And is, you know, after a few months she's still distraught and decides that she would like to commit suicide and goes and asks for permission from this judge. Should she be able to do that?
I think that it should be under the basis of she should go through psychiatric help. She should seek counseling from a doctor, and she should seek prevention first. And it should be ran through her parents and her immediate family, because in the end, it is not her decision as a minor whether she wants to end her life or not without her parents' consent of her emotional state, and whether they could help her get better, or they could help her grow out of this state of depression.
To further that, as we stated before, there are prevention programs offered for people who have had thoughts of suicide or self-harm. And I think that would be a very good thing to consider, that there are those options for her that she should go through before just deciding, I'm just going to end my life because I can't live without this guy.
I mean, just one aspect which we haven't really covered is the role that doctors are supposed to play. I mean, I think it is mentioned in the case, but doctors have and they've taken up this certain role, and they have certain responsibilities, right? And there's supposed to be this sort of trust between doctors, and one of the most important things, you know, the oath that do no harm, right? So in some sense, right, helping someone kill themselves is like the final, ultimate harm that